This is Matt from Axial, and this is our solution to the challenge. Meet Everett Adams, a 55-year-old male who's having trouble breathing. He calls 911. He's picked up by an EMS crew who capture his condition and enter it into the EMS system. Now, information is often lost at provider handoffs, but Axial has a solution. We're able to capture all of the EMS data, translate it, and make it available to the ER team. So you see incoming runs from a variety of counties, and we find Everett Adams there at the top. So we can click through. Now we can match his EMS record against the EHR record at the hospital and pull it in as an HL7 message. At ER registration, we go to work on the next information gap, inpatient to outpatient. So we let Everett's PCP know via text that he has a patient that's in the ER. He's able to click through, fire up a web browser, use the same username and password that he would for any hospital system to access any hospital system, and click through. Now he's able to see all of the patients that he treats that are currently in the ER or the hospital. So there's Everett. Let's click through and see what happened. At a glance, we get an overview of the full encounter. We see that Everett was admitted to the hospital from the ER. Let's first take a look at that ED summary. For a busy physician, less is more. We see that Everett has been diagnosed with congestive heart failure. We see the nursing disposition, the ED discharge notes, and if we'd like it, we can get the full chart. But this was designed by physicians for physicians to give them what they need in 1 to 2 pages. Now let's go back and take a look at the inpatient. So there's a bit more here. We see the primary and secondary diagnosis, we see the history of the present illness, hospital course, and we see meds. We also notice up top that we have a chest x-ray. So let's take a look at that. Now, if a test result comes in after Everett is discharged, we'll list it here and keep the PCP in the loop via the alerting mechanism we showed you earlier. But here's the image. So now we've closed the gap that occurs when provider handoffs happen. Our next job is to engage the patient. We've built an application that moves a patient through the CMS discharge checklist in a way that builds their confidence in their understanding of their condition and gives them the information and tools they need to manage their aftercare. It's clean and intuitive, and it even talks to you.
Hi, Everett.
The user has the option of having any page read to them, but the overall interface is so clean and intuitive that if you can touch a screen, you can use the system. We start off with the basics. The app is designed to build user confidence and momentum as they move through. The little green circle up top gives a user an indication of the progress they've made through each section. Here we are moving through congestive heart failure. But it's not all just reading. We also have video.
Your heart is a pump. It's a muscular organ about the size of your fist and is located...
After educating the patient on the condition, we move to symptoms and risk factors. It's key to personalize this, so we ask them which symptoms they had. A key feature of the app is teach back. So here we're asking a patient to validate their learning so far. Here's the medication overview with pictures of the meds and usage instructions for each one. We can drill down and do teach back for each one as well. Next, we reconcile the meds with anything else the patient may be taking. The system then suggests a nearby pharmacy based on the patient's address. We provide a Google map as well as a street view, and then we confirm that they have transportation there. Now we're moving on to the next section, which is focused on making the appointments. So the first thing we'll do is provide the ability for Everett to have a reminder sent to him of his upcoming appointment. So he's going to have that sent via phone. Now let's go ahead and schedule that outpatient appointment. If the provider has the ability to send and receive messages via the direct project, we can accept them via this address. Otherwise, we'll just call and schedule the appointment manually. Next, Everett has the ability to set up all those in his circle of care who might be able to help in the recovery. So here we are setting up his son in the system. We'll elect to have SMS messages sent to his son to remind him of Everett's upcoming appointments so that he can ensure that Everett attends them. Everett now understands his condition and his medications. He's scheduled his appointments and set up reminders, and he's ready to tackle the last section, recovery and support. Everett's docs want to keep an eye on his weight, so he's having a wireless scale delivered, so we're scheduling that. We also give Everett the ability to speak to a social worker or have any questions answered about his bill. Everett's made it to the end and notices a $25 gift card that can be redeemed at the drugstore, an added incentive to complete that important step. Here's the summary. The patient and his family will also have printed copies as well as full access to the content post-discharge. In summary, the inpatient and outpatient providers are now literally on the same page. And Everett and his son have the information and tools they need to confidently manage Everett's aftercare given the media of their choice.